Hello everyone and welcome back to Dr. Happy Vagina. This is an educational channel about women's health and my name is Ida Bergman and I work as a gynecologist and obstetrician in Sweden and I also work as a researcher. And today's topic is childbirth after TVT. And what is TVT? It stands for tension-free vaginal tape and it's the most common incontinence surgical procedure for stress urinary incontinence. And we will start with a little background to this topic. So when women give birth vaginally, we have the urethra and the urinary bladder. We have the vagina here. We have the cervix and the uterus. And we have a baby who is about to born. And a vaginal delivery can cause trauma to the pelvic floor. And especially to the area underneath the urethra. So when the baby's head comes out from the vaginal orifice, it presses the area and the tissues around the urinary bladder. And this is why 10% of women who give birth to their first child will develop stress urinary incontinence. It means that you leak small amounts of urine on, for example, coughing or laughing or lifting or running or doing some physical activity that causes pressure to the urinary bladder, and when we don't have the support underneath the urethra, we will have small drops of urine that will leak. And normally this occurs after baby number 1, so after the first delivery. And when these women come and consult me to my outpatient clinic, they say, I cannot go jogging, when I laugh, when I carry my children, I'm leaking urine. And I say, yes, one of the treatment options, which is very effective, is that we perform a TVT procedure. It means that we have this urinary bladder, we have the urethra, and we will place a supportive mesh sling like that goes under the urethra and gives an artificial support. So when you cough or sneeze or jump or do some physical activity, you will have a support for the urethra and you will not leak. And between 8 to 9 out of 10 women gets completely cured and are happy with the results of this TVT procedure. But when the women ask, can I put in this sling now or do I have to wait until I have finished childbirth? Before, we didn't have any answer to this question. And sometimes we had women, maybe they give birth to 1 or 2 kids, they think they are ready with childbirth, they perform this surgery and whoops, something unplanned happened and they get pregnant with maybe baby number 3. They come, Dr. Bergman, what should I do? Should I deliver my baby now by vaginal route, or is this gonna harm the effect of the sling, or should I do a C-section? And before we did research about this, we didn't have a clue. So we advised all the women to wait until they were done with childbearing, and we perform a lot of C-section on this indication. But our research group has performed a study that was published in 2018, and we use the amazing registers that we have in Sweden. So in Sweden we have something called the patient register, where we register all of these TVT procedures that are done in our country. We also have the medical birth register so here we have all the slings. And then we have the medical birth register where we register all our deliveries of all our babies in Sweden. So by matching these two registers, we could find 207 women all around Sweden that first have done a sling procedure and after that have delivered an infant. And we wanted to know how did it go. And to do really, really good research, we also need a control group. This means we want a group of women that have done their sling procedure but have not delivered a baby after this procedure. This is called the control group. And the control group, we found 521 women in the control group that did not give birth after their sling procedure. And these two groups were matched to each other, so they have the same age, because age is a big risk factor for incontinence, and also they were matched by the year of surgery, so year of TVT surgery. So we know that when we ask these women about their urinary symptom, the exact same amount of time has passed since their TVT procedure. Okay, so we have an age and year matched control group, and we send out questionnaires to all these women, and we get an answer from 74%, and this is a very good response rate in a questionnaire study. And this resulted that we write here K for the control group. So we have 374 women in the control group with only TVT procedure but no childbirth after. And then we have 64 women with vaginal delivery after a TVT procedure. And we have 95 women with cesarean delivery after a TVT procedure. Okay, so now we have a lot of answers from women who are exposed to delivery after TVT, and we want to compare these results to women who are in the same age group and the same amount of time after the surgery. We want to see if the symptoms differ between these two groups. And now we will come to the results of this study. So we saw that approximately 20% had some amount of stress urinary incontinence in both groups. There were no statistically significant differences between these two groups. So we can, after this study, say that we have no signs of that a delivery after a TVT procedure will affect your continence symptoms. So it doesn't matter if you give birth after your TVT procedure. We also were looking at vaginal delivery compared to cesarean delivery after the TVT procedure, and we find absolutely no difference between these two groups. So cesarean delivery does not protect you from getting incontinence symptoms if you give birth after a TVT procedure. So we recommend that if you come to my clinic, you have a previous TVT procedure, you are now pregnant, we recommend that you perform a vaginal delivery because this will not affect the result of your TVT procedure. And this was one of the first big studies performed in the world in this question. And now after our study, we have a whole thesis coming from Norway, a thesis from Norway that says the exact same thing. So they did a big study that is very similar to our Swedish study in Norway, and they find the exact same results. The women who had given birth after a TVT procedure did not have more incontinence symptoms compared to women who did not give birth after a TVT procedure. So now we have a lot of data from big studies, well done studies, showing that it's safe to give birth vaginally after a TVT procedure. So hooray for scientific knowledge. And now we have this answer, and I will give this answer here to you. Thank you for today, and I see you next week.